Many women experience changes in their bodies, especially around midlife. It is common to wonder what is normal and what warrants medical attention during these transitions. Any vaginal bleeding after menopause, or significant and unusual bleeding during perimenopause, absolutely requires a doctor's visit to understand its cause. Postmenopausal bleeding is defined as any bleeding occurring 12 full months after your last menstrual period. While some perimenopausal bleeding irregularities are common due to fluctuating hormones, new or heavier bleeding always warrants attention. The primary concern is to rule out more serious underlying conditions, such as endometrial hyperplasia or certain types of cancer, which can present as abnormal bleeding. Early detection is crucial for the most effective treatment. So, how do you know when to pick up the phone and schedule that appointment? First, if you are postmenopausal, meaning you have not had a period for 1 full year, any amount of vaginal bleeding, even just spotting, is a clear signal to see your doctor. This is the clearest and most non-negotiable indicator. For those in perimenopause, when your periods might already be irregular, pay close attention to significant changes. You should definitely contact your doctor if you experience very heavy bleeding that soaks through a pad or tampon every hour for several hours. Also, consistent bleeding between your expected periods or periods that suddenly last much longer than your usual pattern are important signs. Any new spotting or bleeding after sexual intercourse should also be discussed. Finally, if bleeding is accompanied by severe abdominal pain, a fever, chills, or an unusual and foul-smelling discharge, seek medical advice promptly. These symptoms could indicate an infection or other issue needing immediate care. When you visit your doctor, they will likely perform a pelvic exam and might suggest an endometrial biopsy, which is a simple procedure to take a small tissue sample from the lining of your uterus. Another common tool is a transvaginal ultrasound, a safe and non-invasive way to view your reproductive organs. These diagnostic steps are routine and provide valuable information to understand the cause of your bleeding, empowering you with knowledge. Understanding these specific indicators of unusual bleeding empowers you to be proactive about your health. While many instances of irregular bleeding have benign causes, a prompt medical evaluation can provide clarity, alleviate worry, and ensure that any potential issues are addressed early and effectively. Your doctor is your partner in navigating these changes, and open communication is key to maintaining your well-being.